everybody. Welcome to the Walk with the Doc. We are at the Woodbridge Community Center here in the wonderful community of Woodbridge. My name is Dr. Reema Patel. I am an endocrinologist at the Old Bridge Medical Center with Hackensack Meridian Health. And we also have...
Hello, everyone. I'm Dr. Darshini Shah. I'm a new primary care medicine doctor with Hackensack. And just excited to be here and participate and walk with the doc. I think the first thing we're going to talk about a little bit is what is diabetes?
Diabetes is when there is a problem of the body to either produce enough insulin or to have it work appropriately, which is also termed as insulin resistance. Talking about insulin, insulin is a hormone that is produced by the pancreas, which helps the body to absorb glucose. And when there is either deficiency of insulin or a problem with its secretion, that's when high blood sugars happen.
Just to continue on this conversation, there are two types of diabetes that we like to talk about and our patients to know. Type 1 diabetes is something that usually is diagnosed when you're younger, and this is a problem with just not creating any insulin, as you mentioned. And type 2 diabetes is something that's noticed a little bit at an older age, preferably 40 plus is when it's noticed, and that is because your body is not making enough insulin, or as you mentioned, your body is not doing the right thing with the insulin. This being said, diagnosis is important. Seeing your doctor, maintaining healthy lifestyle is to avoid this diagnosis of diabetes. And so I guess we can talk a little bit about how to diagnose diabetes.
Absolutely. So again, diagnosis of diabetes is made by blood tests. So either a fasting blood sugar of more than 126 or a sugar more than 200, a random blood sugar, or done by a glucose tolerance test, or the more commonly used test these days, which is called as the A1C or the hemoglobin A1C. If you have diabetes or pre-diabetes, you probably will have your healthcare provider talk about hemoglobin A1C every single time. And what that means is that it is an average of blood sugar over the past 3 months. Any number that is more than or equal to 6.5% is termed as diabetes. So again, we talked about what is diabetes and what the diagnosis is. We may want to also spend some time talking about what the symptoms of diabetes are and what symptoms a patient with diabetes should not ignore.
Sure, of course. So some of the main symptoms you want to keep an eye out for, if you are using the bathroom a lot more frequently, if you feel like you're getting up in the middle of the night, feeling like you need to go more than usual. Also, if you feel like you're incredibly thirsty, and that has increased. So if you feel throughout the day you usually are having, 4 or 5 glasses of water, now all of a sudden you're craving more water, craving more drinks, that's something to keep in mind of. Monitor your weight. This is very important. If you feel like you are losing weight, unexplained weight loss is a symptom that could be a sign of early diabetes, pre-diabetes, or a sign of a diagnosis of diabetes. Also, you want to monitor your hunger. You could have uncontrolled hunger. That is, your hunger could be changing. But the main things to look out for are increased urination, if you feel like you need to go to the bathroom more, unexplained weight loss. You also may notice some dark patches on your skin. That's something to keep an eye out for. And then change in hunger is something, and if you notice that your wounds are not healing as quickly, that is some of the early signs of symptoms to keep an eye out for.
So one of the important parts of diabetes is also prevention. Prevention is better than cure. I get this question a lot from my patients. Doc, I have a family history of diabetes, or I'm just in general worried about the fact that I'm going to develop diabetes. What can I do to prevent diabetes? So again, lifestyle modification, as we call it, is really the key. I tell my patients there are some genetic factors, there are some factors that you can control, and there are some factors that you will not be able to control. Having a family history of diabetes is a genetic factor that you cannot control, but you definitely can modify your lifestyle to help yourself prevent from developing diabetes. When we talk about exercise, and again, perfect timing because we are here with the Walk with the Doc and we are going to exercise and get our steps in. So the exercise that is recommended is moderate intensity exercise. When we talk about walking briskly can be considered a moderate level activity, but walking slowly may not be accounting to that level. So a moderate level of activity that just breaks you into a sweat, 30 minutes a day for 5 days, or roughly 20 minutes every day, which accounts to around 150 minutes a week, is what the American Diabetes Association, also known as the ADA, suggests to prevent the development of diabetes. Also, if you are overweight or obese, which is something we determine based on a patient's height and weight. Losing about 5 to 10% of your body weight also helps in preventing the development of diabetes. So, walking around 150 minutes a week, whichever way you may decide to divide that, is really what is recommended to prevent the development of diabetes.
Just a hot tip, I love to tell my patients this. If you're walking around a track or at home on a treadmill and you're able to sing a song, you're not walking fast enough. So just walk a little bit faster. If you're able to hold a conversation or sing your favorite tune, walk a little bit faster and just sing it in your head.
That's actually a wonderful tip, Dr. Shah. So, one other thing, again, that is very important, that is very near and dear to all our hearts, especially when you treat diabetes a lot, is foot care and preventing foot ulcers. Foot ulcers, amputations happen, they are seen in the hospital, and it's very important to take care of your feet. So, some pro tips or some hot tips that I have for patients with diabetes is check your feet. What are you looking for? That's what my patients ask. Well, you're looking for cuts, blisters, infections. You want to make sure that you check both the top as well as the bottom part of the feet. If you cannot turn your feet all the way, use a mirror to look at the bottom of your feet. We want to make sure there are no infections. Neuropathy, which is damage to the nerves, is a complication that happens to patients with diabetes, especially if you have long-standing and uncontrolled diabetes. Neuropathy is very subjective. Patients come to me saying they feel they have tingling, numbness in their hands or their feet. They feel like they are stepping on stone, or they tell me that they are stepping on clouds. So it's a very subjective feeling. But the end result is that there is decreased sensation to the bottom of the feet. And unfortunately, with that, people can get hurt and not know that they are hurt. And then, if they do not pay attention to the feet, that wound can become deep and get deeply infected, and in some cases, can need amputation. So, foot care is very important. Again, as we talked about prevention is very important. Make sure you go to a podiatrist, which is a foot doctor. If you have calluses, make sure you go tell your doctor about it and take care of it, because the calluses can break and become infected. Fungal infections can happen. So again, prevention definitely is better than cure. Go to the foot doctor, and they can actually even prescribe custom made soles and shoes for you, which are covered under many insurances. So again, foot care is definitely one of the most important thing for diabetes. Again, we both would like to welcome you to the Walk with the Doc. We are here at the Woodbridge Community Center, 28th November, 11 a.m. We are going to be walking around, and we will be happy to answer any questions.